We begin, though, with that breaking news overnight in the deadly conflict in Afghanistan, where the Taliban is making rapid gains across the country, seizing control of the second and third largest cities, Kandahar and Herat.
The situation is so dire yesterday, the Pentagon said it will deploy 3,000 troops to the capital, Kabul, to help evacuate the majority of staff from the U.S. Embassy. But a State Department spokesman says the embassy will continue to function.
This is not abandonment. This is not an evacuation. This is not the wholesale withdrawal. What this is a reduction in the size of our civilian footprint. This is a drawdown of civilian Americans who will, in many cases, be able to perform their important functions elsewhere.
Joining us now, NBC News global security reporter Dan DeLuce and NBC News correspondent Josh Letterman with the president in Wilmington, Delaware. Good morning to you both. Dan, let's start with you. That was Ned Price there, trying to play down the evacuation of the embassy, insisting the U.S. is sending a message of, quote, enduring partnership with the people of Afghanistan. But how significant is this moment? How urgent is this mission? And do we know how long it could last?
Joe, it is a grim situation, and there's no question that this is at least a partial evacuation. It does not show much confidence either in the Taliban and how they will act if they do come into Kabul, and it doesn't show much confidence in the ability of the Afghan security forces to hold on. The Pentagon is not saying how long the operation will last, but this is 3,000 troops coming in, and just in April there were a total of 2,500 U.S. troops on the ground. So it's kind of an extraordinary moment. This could last weeks at least. They're there to try to help secure the partial evacuation of the embassy and also of Afghan interpreters and others who work for the U.S. government and who have visas and are trying to get out. And they're concerned about the safety of all those people as they board evacuation flights.
And I do believe we have a soundbite from the Pentagon about this. Let's take a listen to that if we have it.
I want to stress that these forces are being deployed to support the orderly and safe reduction of civilian personnel at the request of the State Department and to help facilitate an accelerated process of working through SIV applicants. This is a temporary mission with a narrow focus.
So, Josh, let's bring you in here. President Biden left the White House for his home state of Delaware yesterday without taking any questions about Afghanistan. We know on Tuesday he said he doesn't regret his decision. But is the administration worried about how quickly the Taliban is taking over? What are they saying right now?
Well, they're certainly not happy about the pace with which it's falling. Look, I think that although the Biden administration has publicly had to stand behind this line of, that they hope that U.S. withdrawal from Afghanistan would lead to a negotiated settlement between the Taliban and the Afghan government, and that it was in the Taliban's interest to have that international recognition. Most U.S. officials that you speak to have been pretty clear-eyed about the fact that this was the likely, if not inevitable, conclusion of the U.S. pulling out of this war. I think the two things that are really frustrating to the Biden administration at this point, one is just the rapid pace of this and the fact that despite 20 years of U.S. efforts spent there, the Afghan government and their military still have really not seemed to step up to try to fight this aggressively. You've heard the U.S. government, President Biden and others saying that we need leadership from Afghanistan. They need to step up and defend their own country. In a lot of these cities that Dan was just speaking about, the government has folded without a whole lot of a fight. And the other part of this that's deeply frustrating to the Biden administration is the imagery of it. We heard President Biden talking about how he did not foresee a situation like the fall of Saigon, where we would be helicoptering people off the roof of the embassy. And in fact, I think one of the reasons they're bringing in all of these troops right now is to try to prevent that kind of a really dire evacuation of U.S. diplomats and personnel in the country. But the fact that they're bringing in all of these troops, pulling people out of Kabul to the airport ahead of a likely withdrawal of almost everybody from our embassy is a pretty clear visual for for the country and the world that this did not play out the way that they had hoped. And that is something that is very frustrating to the Biden administration.
Dan, let's talk more about what is happening in Afghanistan. The Taliban is making rapid gains across the country, as we mentioned yesterday, capturing Kandahar. The humanitarian crisis is also deteriorating. I mean, what is the latest with that?
It is a really difficult and dire situation for civilians. You know, much of the war was fought in the countryside, but now you have fighting and combat going on in cities, in urban centers, and you have civilians affected. There are thousands of civilians who have been wounded, are being treated in hospitals. There are tens of thousands of civilians who are fleeing or leaving these cities. You see some of them in Kabul now in these kind of makeshift camps. There's concern about how to house these people, how to feed them. So humanitarian organizations are issuing kind of appeals and warnings that this is having an awful effect on civilians. You have 2 hospitals in one city in Lashkar that are literally on the front line, and the gunfire is going on right over the roofs of the hospital. So it's a really awful situation.
Yeah, and Josh, those are some of the reasons the president is facing some intense criticism for withdrawing U.S. troops. Yesterday, Senate Minority Leader Mitch McConnell made that comparison you alluded to, saying that we could be moving toward an even worse sequel to the fall of Saigon back in 1975. To be clear, we're not there yet. But what is the administration's response to the arguments that this withdrawal, especially so quickly, is a mistake?
Well, the Biden administration has made the point back to those critics that, look, this is not something that they necessarily chose. In fact, it was President Trump who put this process in place, made this agreement with the Taliban, and announced very publicly that the U.S. was going to be pulling out. So Biden kind of inherited that set of circumstances, and the Biden administration has said to, try to change it up after he took office would be essentially the U.S. reneging on an international commitment, which would have implications for any other deal we tried to strike in the future. And the other thing you hear from the Biden administration is, they will flip this back to those critics and say, what exactly do you suggest that could have been done differently? There hasn't been an articulated plan for what the U.S. would have been able to accomplish had we stayed there, in addition to the 20 years we'd already been there, that would have changed the ability of the Afghan government and its military to be able to defend its territory in the long run.
Josh Letterman, Dan DeLuce, thank you both so very much. Appreciate it.
Joining us now is retired Admiral James Stavridis. He's a former NATO Supreme Allied Commander and an NBC News Chief International Security and Diplomacy Analyst. Admiral, thank you so much for joining us this morning. Your expertise here is so appreciated on a morning like this. And now, I know you were critical of the president's decision in the first place to completely withdraw troops from Afghanistan. We just heard from Joe there as he mentioned that the president says he doesn't regret it. But is what we're seeing now what you expected to happen? Is it worse? What do you think about what we're seeing?
It is exactly what I expected to happen, but I am surprised how quickly it's happening. So the actual series of events unfolding, the way the Taliban are capable of gradually taking population centers and kind of drawing a noose around Kabul was entirely predictable. What's surprising is the speed with which they've been able to do it and the way that the Afghan army that we all work so hard to train has simply evaporated in the face of combat operations. It's deeply disturbing. And as you know, I commanded that mission for 4 years as the Supreme Allied Commander of NATO. Here's what's different, by the way. At that time, we had 150,000 troops in the country. By the time President Trump came into office, we were down to about 10,000 troops. Personally, I think that would have been a pretty reasonable long-term deployment in order to avoid exactly what we're seeing right now. I think it was a mistake, but it's done, and now we need to think through the consequences.
And Admiral Stavridis, tell us about the state of the Afghan army. I mean, both in your experience and with what you know now. I mean, we're seeing that they've not been able to stop these gains by the Taliban. Do you believe that they're capable of recapturing some of these cities? Could this turn around?
I think it is unlikely that we're going to see a sudden turnaround. What is a possibility, particularly with the additional deployment of 3,000 U.S. combat troops, we still have about 1,500 troops there. That's 5,000 U.S. troops. as the Afghan army and security forces fall back on Kabul, now they're defending a single perimeter, if you will. I think there's a chance they can hold Kabul for some period of time, some number of months. I think that's what the Biden administration is hoping. That would give us a decent interval to withdraw, to try to bring Russia, China, Pakistan, India, to put pressure on the Taliban to avoid a complete massacre in Kabul and in these outlying cities. But boy, it's pretty bleak at this particular moment.
And Admiral, I mean, we're now seeing the U.S. Embassy in Kabul be evacuated, as we've been discussing, and evacuated, in fact, with more troops, 3,000, than were just withdrawn. We've also just seen these two major cities be captured. Do you think this evacuation is a sign the Biden administration is worried that the capital, Kabul, is going to fall soon? Is that only a matter of time?
It is absolutely a signal that the Biden administration is doing the prudent planning and thinking ahead and looking, as we always do in the military, at worst case scenarios. So what they are saying to themselves is, how dark could this turn out to be? Is it possible the Taliban could go sweeping through Kabul in a matter of days or weeks? And clearly their analysis, their answer is yes, it's at least a possibility. So if you're the commander of U.S. Central Command, the four-star general, General Frank McKenzie, you are saying to yourself, I've got to protect the embassy. I've got to protect the American citizens. I want to get out the interpreters who worked with us to do all of that. I need an orderly period of time that I can conduct a withdrawal. That's why 3,000 troops are going to Kabul, 3,000 troops are going to Kuwait, almost 2,000 troops are going to Qatar. This is a 10,000 troop movement into the region in order to create time and space to conduct that withdrawal.
Admiral Stavridis, again, your expertise is so appreciated. Thank you for joining us and really just being able to walk us through with the perspective we otherwise wouldn't have. Thank you.
You bet.
Now we have big news from the FDA this morning. A third dose of the Pfizer and Moderna vaccines has been approved for some Americans with compromised immune systems. It comes as the Delta variant drives new daily COVID cases to a 6-month high. Hospitalizations are also on the rise, more than 30% over the last week, overwhelming ICUs in many southern states just as the school year gets underway.
We're joined by NBC News correspondent Ellison Barber in Hattiesburg, Mississippi, and NBC News and MSNBC medical contributor Dr. Kavita Patel. Ellison, let's start with you. In the dire situation already developing for Mississippi schools, thousands of students and teachers already forced to quarantine and return to virtual learning just days after the school year began there. What are you hearing?
You know, speaking to parents, some of them are very frustrated. They feel like there should have been a universal mask mandate in place heading into the school year, and that a lot of this could have been avoided. They want the governor to do more to try and prevent this from being some sort of routine commonality of this school year. We spoke to two parents. They have a 6th grader, their son. They were so excited for him to be back in school for in-person learning. Their son, he wears a mask. I talked to him and he told me, and I'm quoting here, "I'm a mask maniac." But he said other people in his class were not. They wanted him, again, in that classroom, learning in person. He, like most children, says he learns a lot better when it is actually face-to-face. But instead, right now, he's at home because there was an outbreak at his school. Listen to more of what his parents told us.
Knowing that not all the kids were masking on the bus, not all the kids were masking in the schools. We've heard reports of teachers not masking, that it seemed likely that there would be some outbreaks, but I was actually shocked to hear about the magnitude of the outbreaks district-wide.
I definitely feel like a mask mandate would have at least slowed the spread.
And I spoke to another parent. Her daughter actually contracted COVID-19. They think that she got it from school. She said in hindsight, she wished that she'd had her daughter wearing a mask when she went to school, even though it was optional. But she doesn't think the governor should get involved. She said clearly something needs to change, but she thinks the schools should be making those decisions.
Yeah, I mean, Mississippi has no statewide mask policy for schools, but you've spoken with medical professionals who feel differently. They think the governor should reconsider and get involved. Tell us more about what they told you.
Yeah, let me give you some numbers here to kind of put this in perspective as well. Bear with me because it's probably going to feel like a lot, but the first week of August, 1 week, 342 Mississippi schools reported 1,338 cases. That's among staff and students. So again, that is 1 week this year, 342 schools, 1,338 positive cases. Same time last year, 720 schools reporting. They only reported 897 positive cases. So same time last year, bigger group of school, far less cases. And when we spoke to health professionals in the area, they say that the biggest difference between the week this year and the week last year is that masks were mandatory. Listen to more of what we heard.
Masks within the school system last year worked. Our children were in school learning in person the majority of the year last year because we had masks within schools. And so we are asking the leadership in our state, we're asking school superintendents and school boards to reinstitute those mask measures within the classroom to protect the kids.
Right now, at least 4,000 students in this state are quarantined because of COVID outbreaks. Joe?
Right. Ellison Barber, appreciate all your reporting there this week. Thank you.
Let's bring in NBC News and MSNBC medical contributor Dr. Kavita Patel to go over some of the other COVID headlines of the day. Good morning, doctor. Always great to see you and have you on this Friday. Let's start with the big news from the FDA being this third vaccine dose for some people with weakened immune systems. Walk us through the science behind this that led to this decision, and then who is going to be eligible? Who qualifies?
Yes, Savannah, big news coming out of the FDA really late last night. So the rationale behind allowing for a third dose of either Pfizer or Moderna, we'll talk about Johnson & Johnson in a second, but third dose, Pfizer and Moderna, are for people who have had solid organ transplants or other immunocompromised conditions, HIV, certain cancer treatments, patients taking certain medications that we know from data that has emerged around the world and in the United States, that these patients never really mounted the appropriate immune response. So it's not that the first and second doses have kind of gotten decreased over time, which is happening most likely to all of us because that's human nature. But it's that in these particular individuals, several million in the United States, that they just don't mount enough of an immune response. And the CDC Advisory Committee will deliberate today and vote, and there'll be a little bit more specifics so that doctors and pharmacies can give out these third doses immediately.
Now let's talk about vaccine mandates and requirements. So the Supreme Court has rejected a challenge to Indiana University's vaccine requirement for students and staff, so meaning they are allowed to mandate that vaccine. It's the first legal test of a vaccine mandate to come before the court. So from a medical standpoint, tell me how you feel about that and help us understand the situation colleges are in as students return, especially knowing that the Delta variant is on the rise.
Yeah, it's very interesting. And so absolutely, I try not to act or pretend to do anything I don't know. I'm not a lawyer, but it was interesting to me to watch Justice Amy Coney Barrett, who actually kind of very explicitly said it was within the rights for Indiana University to allow for this mandate. And so that does have implications not only for universities, but it just sets up the precedent that we're in an incredible time where a mandate outweighs kind of the individual freedoms. And I think that that's rational when you think about the fact that many people are infected, might not even know it, Savannah, and could actually get other people infected. And the people around you could then infect, in turn, 5 to 8 more people. That's what we're dealing with the Delta variant. I think the public health implications broadly, I thought it would be a while before we saw so many mandates, but for schools, as they've started, and you just heard Ellison talk about it, these mandates can be critical for helping students stay safe and to also keep an environment where you can have in-person learning, which is the goal this fall.
Yeah, absolutely. And similarly, let's talk about cities. San Francisco has just become the first major U.S. city to require proof of full vaccination to enter restaurants, gyms, entertainment venues. Similarly, New York City, where proof of having at least one dose is now required. Is that what needs to happen to have indoor activities be safe? Would you like to see this happen in cities across the country?
Yeah, it's not a surprise that I'm on the side of asking for people to be both transparent about their requirements. So you've seen signs now that say vaccines required, et cetera. Number two, also to actually encourage people. I do not think that everybody is going to 100% of the country is not going to get vaccinated for a lot of different reasons. But I think the places we're talking about, gyms, restaurants, bars, theaters even, these are places where many of us are not going. We know that from statistics because we're not feeling confident and comfortable. I want to see America feeling comfortable. The best way to get there is to say, look, we're only letting you in if you're vaccinated. And I think what will be interesting is to make sure we have a very common way to show that we're vaccinated. Fumbling for our cards and doing all of this is not practical.
All right, Dr. Patel, good to see you. Thank you so much.
Dangerous heat from coast to coast is unrelenting this morning, impacting millions of people. Cities like Boston are in a heat emergency, with the temperature expected to feel like they're in the triple digits today. NBC 10 Boston reporter Katie Brace joins us now from along the Charles River in Cambridge. Katie, thanks so much for joining us. You know, the acting mayor in Boston declared a heat emergency on Tuesday. What's the weather been like this week for residents, and what's being done to try and keep folks safe?
Well, in 2 words, hot, sticky. Starting Wednesday, the weather has progressively gotten hotter over the past few days. And even last night in the overnight hours, it did not feel less than 80 degrees, which is very uncommon here in Boston. Today, as you mentioned, it will feel like it's in the triple digits. The good news, though, is we're supposed to have some thunder showers later today, and the weekend will hopefully not be as hot as it has been Wednesday, Thursday, and today.
All right, Katie, thank you so much. We're watching those heat waves across the country, fires out west, plus Tropical Storm Fred.
Let's check in on all of that with Bill Cairns and also your forecast. Hey, Bill.
Hey, good morning, everyone. Before we get to that weekend forecast and the impacts from Fred, we have to talk about the heat today. Today, we're going to have a chance for another heat record in Portland, Oregon. So the most times Portland, Oregon has ever hit a 100 in the summer was 5. We tied that yesterday when it hit 103. We're expecting another day today around 102 to 103. So we will have 6 100-degree days this summer in Portland by the end of today. That's impressive. Yesterday at Dulles Airport, just outside of Washington, D.C., we hit 100 yesterday. That was the first time in 2 years. In downtown D.C., it was 96 yesterday. It will be similar today. Heat advisories for 76 million people. Also, some heat warnings. Relief is on the way, but not yet. Not for today, as we mentioned. We should have a heat index above 100 from Memphis to Nashville, all the way up to D.C. into New York. The gorgeous, beautiful, almost fallish type air is on its way, though. Minneapolis today, 79 degrees and low humidity. Green Bay, that'll be perfect, too. And pretty enjoyable summer day. Chicago into Detroit and Cleveland. Into next week, especially Sunday, Monday is when that arrives on the East Coast. Saturday's kind of the transition day. And as far as the tropics, the latest with what will eventually once again be Tropical Storm Fred. We have tropical storm warnings for the Keys, watches for areas around Fort Myers. It's a very disorganized, weak storm right now. There's really not much to it. It'll end up being just a big rainmaker, not concerned with waves or storm surge or wind. It'll just be a big rain out as we head into the weekend, especially Sunday into the southeast. And that could even last, guys, into Monday and Tuesday, as it'll be a slow-moving storm. So you don't need a powerful hurricane to have high impacts if you get a lot of rain. Sometimes even a tropical depression can give us a lot of trouble. So we'll watch that.
All right.
Right.
Keep an eye on it. Thank you, Bill.
Yeah, thanks, Bill. See you in a bit.